There have been a lot of speculations as to whether or not savior siblings are the right thing to do or an unethical act. But what are savior siblings? The creation of a savior sibling involves a selection of an embryo via HLA tissue typing and PGD that, when born, could provide umbilical cord stem cells or tissue to an older sibling suffering from a serious medical condition that may be treated by such a donation. Some things that savior siblings are used for include, but aren't limited to, beta thalassemia, Fanconi anemia, Diamond-Blackfan anemia, and myelodysplastic syndrome. Beta thalassemia is a blood disorder that reduces the production of hemoglobin. Hemoglobin is the iron-containing protein in red blood cells that carries oxygen to cells throughout the body. The signs and symptoms of thalassemia majorly appear within the first 2 years of life. Children develop life-threatening anemia. They do not gain weight and grow at the expected rate, and may develop yellowing of the skin and whites of the eyes. Fanconi anemia is a condition that affects many parts of the body. People with this condition may have bone marrow failure, physical abnormalities, organ defects, and an increased risk of certain cancers. The major function of bone marrow is to produce new blood cells. Fanconi anemia occurs in 1 in 160,000 individuals worldwide. This condition is more common among people of Ashkenazi Jewish descent. In Diamond-Blackfan anemia, the bone marrow malfunctions and fails to make enough red blood cells, which carry oxygen to the body's tissues. Symptoms of anemia include fatigue, weakness, and abnormally pale appearance. The resulting shortage of red blood cells usually becomes apparent during the first years of life. Diamond-Blackfan anemia affects approximately 5 to 7 live-born infants worldwide. Myelodysplastic syndrome, or MDS, are a group of diverse bone marrow disorders in which the bone marrow does not produce enough healthy blood cells. MDS is often referred to as bone marrow failure disorder. In the early stages of MDS, patients may experience no symptoms at all. A routine blood test may reveal a reduced red cell count or low hematocrit, sometimes along with reduced white cell or reduced platelet counts. MDS is primarily a disease of the elderly, but MDS often affects younger patients as well. Now, you might be wondering, who actually uses savior siblings? Why does it sound a lot like My Sister's Keeper? And why is Giovanni so incredibly handsome? Never fear, I can answer 2 of those questions. As to who uses it, in October 4th, 2000, the Nash family made medical history by being the first family to use savior siblings in a bone marrow transplant. Linda and Jack Nash had a daughter, Molly, who was 6 years old. She suffered from Fanconi anemia. Her parents carried the gene without ever knowing it. A doctor recommended to them that her chance of survival could increase by about 55% if they had a savior sibling to use the umbilical cord blood from. After 5 grueling cycles of in vitro fertilization and pre-implantation genetic diagnosis, baby Adam was born. Within 3 years of treatment, Molly was in healthy condition and lives a healthy life. This procedure is not always approved, however. For example, there was another case in the UK. Charlie Whittaker, the boy who was once at the center of a fierce debate over so-called savior siblings, has been given the all-clear by doctors. 6-year-old Charlie, who had Diamond-Blackfan anemia, received a transplant of cells taken from the umbilical cord of his brother James. The Whittaker family used PGD to conceive a child that would be an exact tissue match for Charlie, since no one else in the family was a suitable bone marrow donor, and no other suitable donor could be found. Like bone marrow, the umbilical cord contains blood stem cells, which can be used in transplant operations to treat conditions that affect the white or red blood cells. But the Human Fertilization and Embryology Authority refused the Whittakers permission to undergo the procedure in the UK. So, the family traveled to the US for treatment. At the time, the HFEA said that the PGD could only be authorized to avoid passing on a serious inherited illness to the child. And why do you think Giovanni is so handsome? Well, there could be a couple reasons, but I can think of one reason in particular. But I'll never tell my secret.